Therapists, what's the most disturbing thing a patient has disclosed to you? My patient's parents were having problems, and they shouted at each other almost every night. One evening, when my patient was 11, she came home to find that everything was normal. Everything. No shouting, no throwing things, no nothing. She had a feeling that something was wrong, but dismissed it and walked to her room. A few hours had passed and still, nothing had happened. Her parents were sitting in the living room, not talking. Then she realized that her aunt was missing. Alarm shot through her as she remembered that almost every single one of their fights were about her. Immediately, she sprinted through the door of her room and instinctively went to her parents' room. She got in, not even caring if her parents heard her, and shouted her aunt's name. Nothing, no answer. She knew she didn't have much time before her parents came running upstairs, so she quickly went to hide in the closet. To her surprise, there were no clothes, and it stunk really bad. She took out her phone and shone a flashlight around. She looked in dismay as she saw her aunt, limp, vomit dripping from her mouth. She almost vomited herself in disgust. She could hear her parents looking for her in their room. She started feeling terrified. The minute she heard them leave and close the door behind them, with a key, she left the closet slowly, careful not to make any sound, and dragged her aunt to the window. Her aunt was very young, much younger than her mum, so she wasn't all that heavy, and threw her outside. She then jumped. The window wasn't very far from the ground. They lived right next to a forest, so she landed in a bush. She started dragging her aunt and trying to run as far as she could. When she was a few meters away, she fell on the ground, exhausted. Then, for the first time, she looked back at her aunt. Her heart dropped. Her aunt wasn't breathing, and she had no heartbeat. She was dead.